Now I would like to ask the same thing to Dr. Rajeev Jayadevan. What is the confusion?
Goelji, talking about confusion, let me ask you, there are four of us talking on this panel: Dr. Rajan Sharma, you, Dr. Indu, and myself. Imagine that the four of us were sitting in a room in a building that caught fire and smoke was rising in our room. Do you think we'll survive by social distancing, by keeping 2 foot or 1 meter distance between each other and stay in the room? No. You gotta get out of the building, jump out of the window, and escape. You gotta go to the open air. That is a confusion. The virus spreads inside a room exactly like smoke. What is the confusion? The confusion is when we tell people that you can sit inside a room and if there's an empty chair next to you, you're safe. That is the confusion. That is a fundamental flaw in the worldwide education about the pandemic. This is an indoor virus. Of the 2,400 super spreading events documented in the world, 2,400 are indoor events. We fail to see that. We fail to communicate that. The common man thinks if you can put your hand, you can keep the virus away. That is absolutely wrong, unscientific. As Dr. Rajan Sharma and Dr. Indu said, the virus spreads through the air. And if you're trapped in a room with people, you will pick up the infection. There is no confusion about that. Now, Dr. Rajan Sharma was my president when I was president in the Cochin branch. He was a national president, most dynamic leader. Let me give you an example of how committed he is. He called me personally long before the pandemic to talk about something we started here as a stress line for healthcare workers. Our branch in Cochin, we have a dedicated stress helpline for doctors. He called and said, Rajeev, can the country copy your model? You know, that is commitment. And yesterday, the reason why I raised this topic is, Goelji, yesterday, I got a distress call from the head of pulmonary medicine in one of the large medical centers in Kerala. That doctor said, nurses and doctors are breaking down. Can you give me that helpline again so that I can give them some relief? This is the reality in India. Healthcare workers are on the verge of collapse. Healthcare workers are not a machine that can function endlessly. They sit inside sweaty suits, behind masks. They're not able to see their patients or their families, and they're struggling with people who are dying under their care, and they have very little to offer. As Dr. Indu said, let's come back to vaccination. We need to see the big picture. Why are people dying? The answer is very, very simple. Because the human body has never seen this virus before. And how do you get the human body to recognize this virus? Simple. Give them a vaccine. Any vaccine is good. There are about 8 or 10 vaccines that are given to millions of people around the world. Let's vaccinate our people. And that is the way out.
Okay, thank you, Dr. Rajiv. And you rightly said about the breaking of the down of the doctors and nurses. I had a program of media conference. I asked the same question to one doctor: ki if you are treating a patient of COVID, and if you know that the disease is so much you cannot save, no problem. But if you know that this patient is going to be saved, but for want of oxygen, he is dying in front of you, how you felt? He says, when we are coming home, we are like want to weep, we want to cry like anything, because we are seeing the death occurring from our negligence. Our means the government negligence, because there is no oxygen. Thank you very much, Dr. Rajiv, for giving your opening remarks. And what is the reason for charging the money when at that time also the smallpox, everyone was provided free of charge, BCG, polio? Then why now you are charging the money for this vaccine, Dr. Rajiv?
It's a very good question, very deep question. That question encompasses several topics, including medical ethics. We've got virology, we've got immunology, we've got economics, national policy. There are so many aspects to that question, and also law. Now, I'm no expert in law or intellectual property or anything outside of science, but with my limited knowledge, I'll answer that question as follows. Vaccines have historically been provided free for all citizens. That's the truth. But there are also vaccines that are available for purchase. For example, if I got bitten by a dog, I have the option of going to the government hospital and getting the vaccine free of cost, or I can ask the local pharmacist for a paid supply of rabies vaccine. Now, in terms of our vaccination drive, we must remember that India's or the world's vaccination drive is primarily to vaccinate children. And children form only a subset of our population. And then there is vaccination for pregnant women. Adult vaccination is there, but it is not a large percentage. But suddenly, this virus has landed in our lab, and we are now talking about vaccinating the entire adult population to start with, and maybe children later on. So suddenly, you're having to drive a very large amount of traffic through our limited roads. So there will be some adjustments that will need to be made. Some rules will have to be rewritten. That's the way I see it. I take a very practical standpoint. I'm not very dogmatic about this. My wish as a doctor treating patients from the grassroots level with experience in about 4 or 5 Western nations, I'll say this. The faster we vaccinate, the better. I'm no economist. All I want is for the people to get the vaccine. Now, to answer a point that Dr. Indu raised, I'll say this. I said the virus landed in our lab. Now, let's go back to a couple of fundamentals here. The virus never came with an instruction manual. That manual is being written, and it's being written page by page every day as we speak. So I think we must give ourselves a little bit of breathing room in terms of what we believe in terms of gaps and vaccination gaps and so on. We just have to trust the people who take these decisions. So rather than blindly question their judgment each time, I think we must decide that we will trust the people who are deciding these vaccine gaps for us, because they are doing it in the best interest of the nation. That's one. The second thing is the human body itself did not come with an instruction manual. I would say maybe it's about 10% complete, maybe 90% we do not know about the human body, specifically about immunology. The subject I've spent the most time in my life reading is immunology. I'm still reading about it, including today. But there is so much that we don't know about immunology. So you put the two unknowns together, you see the level of uncertainty is quite high. One of the things I always say in my science lectures is the most important thing in science is to respect what is not known. The problem comes when you assume you know everything. If you assume you know everything, you are inviting disaster. Back to you.
Okay, thank you, Dr. Rajeev. So now the question comes, who knows everything or who doesn't know? You are making profit if you are manufacturing. If you are manufacturing 1 lakh, definitely the profit will increase, not decrease. If the quantity will increase, the profit will increase. How come now we are purchasing more and he is asking more money? What is the logic, Dr. Rajeev?
My expertise, Mr. Goel, is in the science of vaccines. This question is beyond my knowledge, and I'm in no position to answer that.
No, but you are working in a very social thing. You know the condition in the country. After all, we are not a rich country to pay. And one more thing, if you have, I will just say one thing. As per the as per, I will just tell you, there is a complete report. As per the agreement, Oxford University, AstraZeneca can be sold only for $3 till pandemic last all over the world. Only after pandemic is over, company can charge higher price from developed countries, not from the developing countries. We are a developing country. How come they are allowing to sell in India for more than $4 to state and more than $8 per dose from private hospitals? It is against I think that comes under the ethical things, when, or I don't know about the legal, but when it was decided, and we are a developing country, we are not developed country, why we are paying more? That is my question.
Yeah, there is no disagreement among doctors that vaccines must be provided free to all citizens. There is no disagreement. As to the means to achieve that end, I do not know. As I said, this question should be taken up by someone who handles economics and policy decisions.
Okay. Okay, Dr. Rajiv, thank you. Now my question goes to Dr. Rajiv. Very simple question. We are talking of vaccination, vaccination, vaccination. Where now we have made a portal. Now the portal, how you see 70% of the population is in rural area. Now, how the rural, if a villager, now this is a question, I'm sure you might be anyone, but a person who is not knows, first thing is the villager is not knowing how to use a smartphone. Even if he knows, the internet is not there. Now, all those, how he's going to be vaccinated? It means we are only giving vaccination, as Dr. Sharma has mentioned, we are leaving the cattle class. So are we not partial, or we are just saying that we will just save only the elite class? But according to medical experts, and I'm sure you will also, unless the 70% will not get the vaccination, we will not get the herd immunity. And the 70% means we have to take the majority of the rural area. How we will get it? So is there any solution you think that the government should do? After all, you have worked in UK, you have seen very closely in USA, you have worked there, you have seen their health systems. Where is the mistake? What is the basic thing? After all, we require vaccine. Everybody wants vaccine. Government also wants to give vaccine, but it is not reaching. Now, why? What is the solution if you want to give?
That's an excellent question that was raised uh, several months ago by some of us doctors here, as well as some of my friends in the legal fraternity. They asked whether they should file a PIL about this decision, about asking citizens to uh, go through an internet-based registration for vaccines. It made no sense. I'll give you an example. We often refer to India in the context of pandemic, but what we fail to realize is, in a global sense, India represents a very large area of the globe. Forget the boundaries, but we are this region. Let's just talk pure science here. This region is a very, very large area that has extreme geographical and economic and cultural and social diversity. We can't put India into a box. We can't. Therefore, what is applicable in, let's say, the rural part of, let's say, Assam might, might not be applicable.
One moment, please. One moment. I think Dr. Yeah. Yes, please go ahead. Sorry.
What is applicable in a rural part of Assam might not be applicable in, let's say, the urban parts of Mumbai. The strategies will have to be customized for each region. For instance, Kerala, if you take Kerala as a region, as a whole, the internet connectivity is quite high. But that still does not mean that everyone in Kerala, even with the highest internet connectivity, will be able to operate a smartphone. I live with my old parents. My mother barely knows still how to use WhatsApp. All right, so she's a retired college lecturer. All right, so she holds a postgraduate degree from BITS. No, but that is how they are. So we need to really simplify the vaccination process. That is something that we had been discussing for a long time. We can't have so many hurdles to an already strained system. I think we must find alternative ways of verifying IDs. I think that we should decentralize to an extent that it must be door-to-door vaccination. We can't have people crowding in spaces, particularly indoor spaces, because they will get the virus instead of getting the vaccine. So it may actually be counterproductive to have large crowds. Right now, you can see panic vaccination happening in parts of the country. People are just uh, crowding around these vaccination centers. So all of these must be taken into context, and a change in strategy is needed. I advocate door-to-door vaccination, vaccination in the smallest clinics, because we know that vaccines are not any are not dangerous. See, these vaccines are not killing people. The chance of getting a serious allergy is about one in about 2.5 lakh to maybe 1 in 5 lakh. It is so rare that if such an event occurs, there must be a backup plan for transferring that patient to a nearest health facility. But that doesn't mean that every vaccine must be given to it through a very large health facility. My point is, let's decentralize it, um, give it freely to the public, and make it reach the most remote parts of our country as easily as it reaches the most urbanized parts, rich and poor alike.
Thank you very much, Dr. Rajiv.